Medical nanotechnology has revolutionized the field of medicine by offering innovative solutions for the diagnosis, treatment, and monitoring of various diseases, including cancer. In recent years, there has been a growing interest in the application of nanotechnology in the field of esophageal cancer treatment. Esophageal cancer is a challenging disease with limited treatment options and poor prognosis. However, the unique properties of nanoparticles and their ability to target and deliver therapeutic agents specifically to cancer cells have opened up new possibilities for improving treatment outcomes. Nanoparticles, with their small size and ability to interact at the molecular and cellular levels, have emerged as promising tools for targeted esophageal cancer treatment. These tiny particles can be designed to carry therapeutic agents, such as chemotherapy drugs or gene therapies, directly to the tumor site. By utilizing various targeting strategies, such as ligand-receptor interactions or surface modification with antibodies, nanoparticles can specifically bind to cancer cells while sparing healthy tissues. This targeted approach enhances treatment efficacy while minimizing systemic toxicity. The design and optimization of nanocarriers play a crucial role in the success of nanoparticle-based therapies for esophageal cancer. Various factors, such as the choice of materials, size, shape, and surface properties of the nanoparticles, impact their stability, drug loading capacity, and release kinetics. Researchers have explored different types of nanocarriers, including liposomes, polymeric nanoparticles, and inorganic nanoparticles, to achieve optimal drug delivery outcomes. Additionally, advancements in nanotechnology have enabled the development of stimuli-responsive nanocarriers that release therapeutic agents in response to specific cues, such as pH changes or enzymatic activity within the tumor microenvironment. Nanotechnology provides both passive and active targeting strategies for esophageal cancer treatment. Passive targeting relies on the unique physiology of tumors, such as enhanced permeability and retention effect, which allows preferential accumulation of nanoparticles within the tumor site. Active targeting, on the other hand, involves the functionalization of nanoparticles with specific ligands or antibodies that can recognize and bind to tumor-specific markers. This active targeting approach further enhances the specificity and selective delivery of therapeutic agents to cancer cells, thereby improving treatment outcomes. In addition to therapy, nanotechnology has also made significant contributions to esophageal cancer diagnosis and monitoring. Nanoparticles can be engineered to act as contrast agents in various imaging modalities, including magnetic resonance imaging, MRI, computed tomography, CT, and optical imaging. These nanoscale contrast agents possess unique properties, such as high stability, biocompatibility, and tunable optical properties, enabling improved visualization of tumors and early detection of esophageal cancer. Furthermore, nanotechnology-based imaging techniques offer the potential for real-time monitoring of treatment response, allowing clinicians to make timely adjustments to treatment plans. Theranostics, a combination of therapy and diagnostics, is a rapidly evolving field that holds great promise for esophageal cancer treatment. Nanoparticles can be designed to integrate both therapeutic and diagnostic functionalities within a single system. These multifunctional nanoparticles can simultaneously deliver therapeutic agents while providing real-time imaging and monitoring capabilities. By incorporating imaging agents, therapeutic drugs, and targeting moieties into a single nanoparticle, theranostic platforms enable personalized and precise treatment strategies, thereby maximizing therapeutic outcomes. Nanobiosensors have emerged as powerful tools for the detection and monitoring of esophageal cancer biomarkers. These devices utilize nanomaterials, such as carbon nanotubes, gold nanoparticles, or quantum dots, to enhance the sensitivity and specificity of biomarker detection. Nanobiosensors offer the potential for early detection of esophageal cancer, enabling timely intervention and improved patient outcomes. Additionally, the development of point-of-care nanobiosensors holds promise for rapid and non-invasive screening methods that can be implemented in resource-limited settings. Photothermal therapy, a non-invasive therapeutic modality, has shown great potential in esophageal cancer treatment when combined with nanoparticles. By incorporating light-absorbing nanoparticles, such as gold nanorods or carbon nanotubes, into the tumor site and subsequently irradiating them with near-infrared light, localized heating occurs, resulting in tumor cell death. This targeted approach offers precise control over the treatment area while sparing healthy tissues. Moreover, the photothermal effect can be synergized with other treatment modalities, such as chemotherapy or immunotherapy, for enhanced therapeutic outcomes. Tissue engineering, in combination with nanotechnology, has the potential to revolutionize the field of esophageal cancer treatment. By utilizing nanomaterials and bioactive scaffolds, researchers are exploring the development of functional esophageal tissue constructs that can replace or regenerate damaged tissues. These engineered tissues can be used for in vitro drug screening, personalized medicine, or even transplantation purposes. Nanotechnology assists in controlling scaffold properties, cellular behavior, and tissue regeneration processes, leading to improved outcomes and patient quality of life. Immuno-nanotechnology represents a promising approach for enhancing the immune response against esophageal cancer. Nanoparticles can be engineered to carry immunomodulatory agents or antigens, stimulating the immune system to recognize and eliminate cancer cells. Additionally, nanotechnology-based vaccines can be designed to deliver tumor-specific antigens, enhancing the efficacy of cancer immunotherapy. The combination of nanotechnology and immunotherapy offers potential synergistic effects, leading to improved treatment responses and prolonged patient survival. Nanorobots, miniature devices capable of performing precise tasks at the nanoscale, hold immense potential in esophageal cancer treatment. These nanoscale robots can be designed to navigate in the body, specifically target cancer cells, and deliver therapeutic payloads. By incorporating sensors and actuators, nanorobots can autonomously detect and respond to tumor microenvironment cues, enabling on-site drug release or localized therapies. Furthermore, nanorobots offer the opportunity for real-time monitoring and feedback, ensuring optimal treatment outcomes. While nanotechnology-based treatments for esophageal cancer offer immense potential, there are concerns regarding their potential toxicity and long-term effects. Extensive preclinical and clinical studies are essential to evaluate the safety profiles of nanoparticles, ensuring their biocompatibility and minimizing potential adverse effects. Additionally, thorough understanding of nanoparticle biodistribution, metabolism, and clearance pathways is crucial. Efforts are underway to develop standardized protocols for nanoparticle characterization, toxicity assessment, and regulatory guidelines. In conclusion, medical nanotechnology has ushered in a new era in the treatment of esophageal cancer. The unique properties of nanoparticles, combined with their ability to target cancer cells and deliver therapeutic agents, offer promising opportunities for improving treatment outcomes. Nanotechnology has also enabled the development of advanced imaging techniques, theranostic platforms, nanobiosensors, and tissue engineering strategies for esophageal cancer management. However, thorough research, regulatory compliance, and careful consideration of potential toxicities are necessary to ensure the safe and effective translation of nanotechnology-based treatments into clinical practice. The future of esophageal cancer treatment lies in harnessing the full potential of medical nanotechnology and interdisciplinary collaborations to overcome the current challenges in this devastating disease.